Okay, so today we're going to talk about treatment of psychology, abnormal psychology. And the first thing we're going to do on the slide is we're going to look at the approaches. So there's several different approaches to how we actually deal with the treatment of psychotic disorders, psychiatric disorders, and different developmental psychiatric disorders. First one we're looking at is Freud. Freud's psychodynamic theory. Again, anything psychodynamic is tied to Freud. And so what we've got here is Freud likes to use free association, dream analysis, interpretation, etc. Again, this is a very good idea if you're trying to figure out like the root causes of problems, especially if you ascribe to the idea that your subconscious is driving your behaviors. So you might see a situation where how does this make you feel? How do you feel about your father, your mother? Those kind of things that draw back into the past. Like, what did you see back then? What has shaped you there? Some of the critiques about psychodynamic is, again, not everything is subconscious. Maybe, this is just a decision. This is a learned behavior, and psychodynamic's not really going to address that. Again, this is a good one if you're trying to deal with maybe memory loss, or you're dealing with sort of the idea of dissociative amnesia, where you can't really remember what it is, digging deeper, kind of going further back to see what's going on. Humanistic is the next one. Again, this is sort of your Rogers and your Maslow, the hierarchy of needs. So you're dealing with people who are, the idea of you want to improve, so that's kind of at the heart of humanism there. Basically, this is going to be your traditional therapy, which you typically see of the guy laying on the couch and he's talking about his problems and what can you do to develop and get better there. Gestalt therapy is a type of therapy that focuses on the here and now. So in other words, this isn't looking forward, this isn't planning forward. It's like, what do you need to do right now? What are your feelings right now? What are you experiencing right now? What do you want to be right now? Whereas the existential is looking beyond you. It's looking on the meaning of things, the future. Where do you plan to go as things move forward? We get down here to behavioral, which is another approach. Behavior therapy uses classical conditioning. Remember, classical conditioning is like your Skinner box. It's not the idea of you reward somebody or you punish someone based upon what it is. It's the idea of basically you reinforce. If a bird taps for food, you give it the food, and so it learns this behavior, and so you can kind of teach different things. So behavior therapy is essentially that. It's this idea of if you do the right thing, you are reinforced for it. Basically, you're told that's done. You do it over and over again, repetitive, a lot of repetitive things. Try this over and over and over again. Behavior modification is going to use operant conditioning. And sorry, I back up. Let me back up. That's not, Skinner box would be operant, and classical conditioning would be Pavlov's dog. So basically the idea of you find what's natural within the behavior therapy, and you sort of reinforce that. You kind of train it to adjust to a different stimulus and that kind of thing. Whereas behavior modification, that's the reward and punishment. That's the Skinner box model. You do the right thing, you get a reward. You do the wrong thing, you get a punishment. Oftentimes this is used in addictive therapy. So if you're dealing with somebody who has an addiction, there's a punishment involved if you partake of this particular addictive tendency. There is either a positive punishment where there's some sort of possible pain or discomfort that's caused by it. So I think one of the things might have been like if you smoked a cigarette, you got a shock or something, those kind of things. Of course, negative punishment would be you remove a right. If something happens, then you remove something that a person had previously access to, and then that's gone because you failed to move on. Cognitive therapy, Ellis has rational emotive therapy, and this is essentially a challenging a belief thing. This is going to be where somebody has a set of beliefs about the way things are or should be, and you want to challenge that to be what's going on. So if somebody believes that they are incapable of overcoming a certain phobia, say, rational emotive therapy would basically challenge that belief. If somebody's paranoid schizophrenic, for instance, if you're using rational emotive therapy, you would attack the fact that they believe everybody's out to get them, that everybody is looking out to attack them. So you might rationally challenge that by saying, okay, name one person. And if they can name one person, then you ask them, well, what makes you think that they're out to get you? And you sort of step by step go through it, and you try to get them to realize that their beliefs are not founded in reality, that their beliefs are based upon the disorder, and it's not coming from anything in reality. Belk uses cognitive therapy, which is specific to this particular overarching cognitive therapy. And this is just change thinking to challenge depression. If you think about it, really depression is one of those things that even if it's a chemical cause, it can be made worse by our line of thinking. If we continue to dwell on it, it creates that sort of spiral, that like anxiety tornado, but in a depression version. Biological has several, some of which are controversial, some of which are not. Controversial would be electroconvulsive therapy or shock therapy. Again, not very much used anymore to my knowledge. It kind of went out of favor about 20 or 30 years ago because people realized that they were electrocuting people, and that's not a good thing. So they stopped doing electroconvulsive therapy for basic things, but people were doing it for all sorts of things. I think in the 50s they used shock therapy for people who were homosexual, because at that point DSM-5, or not DSM-5, DSM-1 or 2 or whatever it was at the time, had homosexuality listed as a psychological disorder, and so people would try to shock you out of that. Psychosurgery, it does still happen. Probably the most famous version is a lobotomy, where they would actually remove a portion of the brain that was not functioning properly. And the obvious problem for that is that you are taking a chunk out of a person's brain, and that does more than just eliminate the negative behavior. It often eliminates positive behaviors and things that are necessary for survival. So there's some stuff that's still done. Obviously, you have brain surgery when it's dealing with tumors and that kind of thing. But as far as changing behavior, I don't think it's done nearly as frequently. It can be done to sort of reactivate certain areas of the brain that have gone dormant. And there's some stuff with brain mapping where it's not exactly psychosurgery, but it is kind of dealing with that kind of deal. Psychoactive drugs are the most common. Honestly, most Americans who have any sort of biological therapy being done, it's going to be medication. First one being antipsychotic drugs. So if you're schizophrenic, if you have an antisocial personality disorder, those kind of things, they're going to be dealt with through medication. But more commonly, you're going to find antidepressants and anti-anxiety medications, which again overlap. Oftentimes they perform the same sort of service within the body, and so you may be on an antidepressant for your anxiety, but that's probably the most primary reason and way in which biological treatment is performed here in the United States.